Dr. Owens, I was wondering if your kid's complaining of pain. Is that really something you should worry about? Is it really that important? I mean, kids complain a lot of times about a lot of different things. So how do you determine whether it's important or not?
Every parent knows when their child, I think, is trying to complain of something to get out of doing something, or to gain favor around the household in some ways. And when it's real. If a child is legitimately complaining of pain, or if it keeps coming up and there's nothing to gain from it, like they don't get out of cleaning their room or doing the dishes or something, then it's probably a legitimate complaint. I would pay attention. A professor of mine once said, where do big health problems come from? And there were various answers, and he then said small health problems. So that's the goal with kids, is taking and handling small health problems when they're in their tens and teens and whatnot, keeping it from becoming a big health problem when they're 25, 27, 30, that kind of
Dr. Owens, I was wondering, when would you determine whether you should bring your kid in for, kids have a lot of accidents. I think if you brought in your kid every time they fell down on the floor, you could be going to the chiropractor quite a few times in a week. But when would you determine, like, hey, it's time for them to see a chiropractor and get an adjustment?
It's a judgment call. There's no right answer there. I look at my kids. If they've had a rough week, with sports, with, I've noticed them tripping and falling around a lot. I'll make sure I adjust them at the end of the week. If they have a rough week, get them in at the end of the week. We can clean up all this, all of the problems and potential problems that could be developing from all those falls. Or, as in the case of this little Japanese boy that came in at the age of 2.5, he was tripping and falling all the time, which told me that there was a nervous problem with his legs. So if your child is falling and tripping just for no reason, that means it's a problem with the muscle control and the nervous connection between especially low back and the legs and the muscles in coordination. And you need to get that checked immediately to get those coordinative aspects back online.
Dr. Owens, I was wondering, why do children have back pain, and what is it a symptom of?
Children very often have back pain. They don't always know how to communicate it. Children have back pain because they have falls. Any of you parents out there with kids know that the kids fall off the slides, they fall off their bikes. All of these jolts to the body produce little impacts that cause misalignments of the bone. So these bones get jammed, and they just get jammed a little bit, and kids are real flexible, so they sometimes don't notice it. But then it gets a little worse and a little worse and a little worse. Kids fall hundreds and hundreds of times before they grow up. But it's a symptom of a spinal problem. Usually when a child has back pain, it's a symptom of a spinal problem, and that's what we work with.
Dr. Owens, I was wondering, what symptoms do you see in kids as far as like illness and flu and that kind of stuff? And then how does chiropractic address those things, if at all?
Kids a lot of times will get, young babies will get colic. And colic is just an uncomfortable baby. The baby's crying for what would seem to be no apparent reason. They're fed. They're just lying there crying. Well, oftentimes because the child can't communicate, they're in a lot of cases in some sort of pain. The childbirth itself is a very traumatic process where the spinal bones, the spinal bones of the baby can get twisted and torqued out of alignment, and the child can't communicate that other than crying. That's a big one. Another big one is, and chiropractic helps with that. We just use a really gentle adjustment with the arthrostem to those affected areas. The baby you can tell the baby has a problem. They'll show some discomfort, but then they'll start to sleep better. They'll start to cry less. As kids get a little older, sometimes they'll have ear infections. And with ear infections, very common, but we'll find problems right in the upper neck. In other words, the bone's jammed out of place, irritating the nerves in that area. And also there's a very simple little ear adjustment that we can do as well, believe it or not, that helps with a lot of these childhood cases. So that's that with kids. They respond really well to care.
Dr. Owens, you mentioned colic as one of the childhood illnesses that kids have. I was wondering if you could expand a little bit more on why kids respond to chiropractic in addressing colic conditions.
Yeah, definitely. Colic, in a lot of cases, the child is in some kind of discomfort or pain. And if you go the medical route, you'll find, they'll check the baby's intestines, and probably everything's flowing through the intestines correctly. You do want to check that out, by the way, make sure there's no intestinal blockage or anything more severe. But usually that comes up negative in a lot of these kids. And so what's happened is that during the birth process, this is part of the spinal bones, and baby spines are just like adult spines. They can get jammed out of place from trauma. And when that happens, you get irritation to nerves. Irritation to nerves causes pain, and what's the child going to do? They're going to cry. So we'll check the child's spine. We just gently feel the spine. We'll find the areas that are really locked up. There'll be typically an area of muscle spasm, or the muscle's really contracted and tight around that area. That'll be the area that we adjust. As we work that and we get those areas worked out, the baby starts to...
Dr. Owens, I was wondering, let's say my kid was having a lot of headaches recently or something. Why should I bring him to you or to a chiropractor before I go and consult a doctor, like a medical doctor?
Doctor specialties really revolve around more emergency type problems. Breaks, severe issues that need, hospitalization. If a child is having headaches and it doesn't warrant, it's not like a severe headache where you would just really get concerned, chances are 90% of the time it's coming from a slight twist of the upper bone in the neck. The very top bone called the atlas. It's the very first bone there as it comes down from the skull. That twists and you get pain in the head. That can happen because kids get their heads twisted all the time. If you go to the medical doctor, you're going to get a drug that's going to cover up or mask the true problem, but it's not going to fix it. And I'm of the opinion that it's not good to be feeding these kids any unnecessary drugs. So that's that on...
Dr. Owens, you recommended, if you got a history of scoliosis in your family, to bring your kid, especially your daughter, in like once a month. What time frame would you be bringing your kid in, like between the age of 10 to 14? And then how long are those appointments, how long do they usually take? I mean, just wondering how convenient it's going to be.
Let's talk about how convenient it is. It's very convenient. We can always find a time slot. The appointments take around 10 minutes. And generally, we would do a check, and then if there's a problem, we would adjust the boy or girl. I didn't mean to make it sound like girls only got scoliosis. Of course, boys get it as well. It's just more common in girls. So we would check them and adjust them at least once a month, and during that adjustment we would find areas of the spine that had been damaged and are stiff. These areas get jammed and then they don't move correctly. And that is the only thing that I can find in the literature that can predict whether a scoliosis is going to occur. In every case, there have been areas of the spine that are rigid and stiff, and especially as the patient then, or your daughter or son or whoever it is starts to move through puberty, and these great growth spurts occur, that's when that curve starts to develop. Again, those stiff areas are totally preventable and very easy to handle, so it's a really good thing to do.
Dr. Owens, I was wondering why a lot of new parents bring in their newborn kids for chiropractic adjustments.
Because it's a smart thing to do, to check the spine of a brand new baby to make sure that all of its spinal segments are functioning and moving correctly. It's a scientific fact that if a spine is jammed out of place for a period of time, it will start to develop arthritis in that area. And I know it's not very common to see a baby with arthritis. I have seen kids as early as age 15 with arthritis in some certain areas of their spine.
Right.
So it's basically an early handling to any spinal problems, and there's generally very little need for extensive treatment programs. These baby spines, we just check them. There's generally a couple of bones that are slightly locked up and out of place. We fix those up just nicely, and we check them in a couple of months, 2 months, depending on how rough and tumble.
Dr. Owens, I've seen you adjust your own kids quite, whenever they seem to have a lot of different problems. I was wondering when you determine, it's necessary for you to give them a child an adjustment.
Yeah, early on, when Quinn was first born, he could not turn his head to one side. He could go all the way to the right, but he could not go to the left. We noticed that with him early on. I started working on him and did some extensive work with him. And by extensive, I mean very regularly. I worked on him daily to every other day for about a year to get his neck straightened out to where he had full range of motion. That would be a huge clue. If you have a child that cannot move fully in some direction, or you see them turn their head and then their body goes with it, that's a good clue that there's a spinal problem. Now, because I'm at work, they're at home, I'll adjust them if I hear they've had a fall or a trauma. Sage fell off the rock wall, or Quinn fell off his bike today, and sometimes we're addressing their neck, their spine, and even get into a kinesio tape in their knee when they have a real hardcore fall. If they twist their knee, we're able to administer treatments that are real effective to these guys. So they enjoy it, and at this point they ask for it. So,
Dr. Owens, I was wondering if children actually enjoy being adjusted.
The straight up answer to that is some kids do, some kids don't. Some kids like broccoli, some kids don't. So it's really individual from child to child. However, we have gone out of our way to try and make it as comfortable as we can for the kids, because number one, we don't want to scare them. You never want to scare a child when you're trying to administer a treatment. They get enough of that from their medical doctors and wherever else. But we use, instead of using some of these, this would be more of an adult tip here. We have a flatter, softer adjusting tip that we use a lot on kids. It makes it more comfortable. We're able to get the job done, and so we have a high percentage of the kids that actually enjoy getting adjusted and like coming into the office. So.